Chikungunya. Chikungunya is a viral disease transmitted to humans by infected mosquitoes, primarily Aedes aegypti and Aedes albopictus. These mosquitoes are also known to spread other diseases, like dengue and Zika. Chikungunya is a viral disease caused by the chikungunya virus, CHIKV, which belongs to the genus Alphavirus and the family Togaviridae. The disease is characterized by an acute onset of fever and severe joint pain. While it rarely leads to death, it can cause prolonged symptoms, especially joint pain, which may last for weeks, months, or even years. Symptoms of chikungunya. Symptoms generally appear 4 to 8 days after a mosquito bite but can range from 2 to 12 days. The majority of individuals infected with chikungunya will develop symptoms, unlike some other mosquito-borne viruses like dengue. Main symptoms. 1. Fever, sudden onset, often above 39 degrees Celsius 102 degrees Fahrenheit. 2. Severe joint pain, arthralgia particularly in the hands, wrists, knees, ankles, and feet. This joint pain is the hallmark of the disease and can be debilitating. 3. Rash, a maculopapular rash, small raised red spots, often appears, typically on the trunk and limbs. 4. Headache, often accompanied by eye pain. 5. Muscle pain, myalgia along with joint pain, it adds to the overall discomfort. 6. Fatigue, extreme tiredness and weakness are common, even after the fever subsides. Some patients may also experience gastrointestinal symptoms such as nausea, vomiting, or abdominal pain. The chikungunya virus is primarily transmitted through the bite of 2 mosquito species. 1. Aedes aegypti. These mosquitoes typically bite during the daytime, especially in the early morning and late afternoon. They thrive in urban environments. 2. Aedes albopictus. Known as the Asian tiger mosquito, it is more resilient and can survive in colder climates compared to Aedes aegypti. The mosquitoes become infected when they feed on the blood of a person already infected with the virus. After an incubati. Complications. While chikungunya is rarely fatal, complications can occur, particularly in newborns and infants, the elderly, over 65 years old, individuals with pre-existing conditions like diabetes, cardiovascular disease, or immune disorders. Chronic joint pain. The most common long-term complication is chronic arthritis, which can persist for months or even years. The pain can be severe and similar to rheumatoid arthritis in some cases. Neurological complications. In rare cases, chikungunya may cause neurological conditions like encephalitis, inflammation of the brain, particularly in newborns or elderly patients. Diagnosis. Chikungunya is diagnosed based on clinical symptoms and confirmed with laboratory tests, including RT-PCR, reverse transcriptase polymerase chain reaction detects viral RNA in the blood, typically within the first week of infection. Serology tests. These tests identify chikungunya-specific antibodies, IgM and IgG, in the blood. IgM antibodies appear within the first week of illness and can remain detectable for months. Treatment. There is no antiviral treatment specific for chikungunya. The focus is on relieving symptoms. Fever and pain relief. Paracetamol, acetaminophen, is recommended for fever and pain. Avoid aspirin and NSAIDs like ibuprofen in the early phase, especially if dengue infection is suspected, as they can increase the risk of bleeding. Hydration. Drink plenty of fluids to prevent dehydration, especially in cases of high fever. Rest. Patients are encouraged to get ample rest, as the disease can cause extreme fatigue. For chronic joint pain, patients may benefit from nonsteroidal anti-inflammatory drugs, NSAIDs, after dengue has been ruled out. Physiotherapy, exercises to maintain joint mobility and reduce stiffness. Corticosteroids, sometimes used in severe, persistent cases of arthritis, but only under medical supervision. Prevention. Since there is no vaccine or specific antiviral treatment, preventing chikungunya is key. The main method of prevention is avoiding mosquito bites. 1. Use insect repellent. Choose one containing DEET, picaridin, or oil of lemon eucalyptus. 2. Wear protective clothing, long sleeves, long pants, and clothing treated with permethrin. 3. Use mosquito nets, especially in areas with heavy mosquito populations. 4. Reduce mosquito breeding sites. Eliminate standing water in containers, such as buckets, flower pots, and discarded tires, where mosquitoes lay their eggs. 5. Install window and door screens. Prevent mosquitoes from entering homes. Most people recover fully, but joint pain can last for months or even years in some cases. There is currently no vaccine for chikungunya, so prevention focuses on avoiding mosquito exposure. Conclusion: chikungunya is a significant public health concern in many tropical and subtropical regions. While it is rarely fatal, its symptoms, especially joint pain, can be long-lasting and debilitating. Preventing mosquito bites and reducing mosquito breeding grounds are the most effective ways to avoid chikungunya infection. Chikungunya.